morning, good afternoon, good evening, wherever you are in the world. It's Dr. Janice Hooker Fortman with Relationship Matters. I hope everyone is having a beautiful morning, afternoon, or evening. I'm here in Chicago, right outside of Chicago, and it was a beautiful day today. It's still nice and sunny, and it's in the 70s, and we are loving it. We are loving it. Well, I think the last episode, the last show, I had stepped off of my soapbox. And I'm stepping back on it. And why? Because the COVID numbers are rising again. And today on the news, now there are two more variants. People, people, please wear your mask. Please wear your mask. We can stop this. I know we're tired of the mask. We're tired of COVID, but in order for us to get over this, to get past this, we have to help ourselves. So I'm not going to stay on my soapbox long, but I'm still wearing my mask, and I've gotten both of my boosters. And there's so many people now, my friends who are coming down with it because they're not wearing their mask. And I understand, I hate it. But protect yourself and protect others. Now, and I'm talking about medical things, and guess what? Today I have on my show Dr. Asante Dickson. He has so much value to bring us. He has so much for us to talk about. And I want to get right to it. So I don't want to talk a whole lot. But before I do, I want to thank everyone who I had told about my husband's health issues. He's doing so much better. So I want to thank all of you for your prayers and your support. So let's bring on Dr. Asante Dickson.
Hello.
Hello. How are you, Dr. Dickson?
Good evening. Thank you so much for having me. Pleasure to be here. I'm doing fine.
Wonderful. Wonderful. So, you call yourself the medical education whisperer. Where'd you come up with that?
I come up with a lot of things. I have my brain is always working, and the medical education whisperer was something that I kind of came to. It kind of came to after giving a couple decades worth of lectures, and my lecture, my lecture variation is pretty wide. But one thing that is very common is that throughout my lectures, whether I'm speaking didactically about hardcore medicine or I'm speaking to the general public about whether it be cognitive or non cognitive issues, I'm always infusing my lectures with messages that the audience can understand and relate to. And so it just kind of made me think, somebody's always kind of like, something's confusing, but somebody just whispers in your ear, that sounds confusing, but really what it is this. All
Okay.
right. That's what I try to do in many of my lectures and talks.
Okay. And I also read that you said you were hip hop inspired. What does that mean?
So that is absolutely true. I am originally from New York, grew up most of my life in Long Island. And for those of you not familiar with New York anatomy, so there are the five boroughs, and then there are the suburbs adjacent. So there's Long Island to the right of Queens, and didn't live very far from Queens. And you can imagine in New York, hip hop, especially in the 80s and the 90s when I was growing up, hip hop was king. It was everywhere, and New York was in charge. There was no California or Southern or Midwest. New York was running everything. And I think the message and the culture was intercalated. It was really woven into my genes, where the music and the delivery And the messaging, I basically took that and transposed it into motivation to push towards my educational dreams.
Oh, all righty. So we know you're a medical doctor, and I know you are a, let me get this right, a neuroradiologist.
Correct.
What is a neuroradiologist?
A neuroradiologist is a physician that specializes in treating and diagnoses diseases in the central nervous system. So that would be the brain and the spine. We use imaging to see, and with that visualization, we diagnose abnormalities and diseases. But we also use that imaging to treat abnormality in images. So, for example, Um, if you've had an MRI of the brain or a CT of the brain, we would be the doctors to interpret those images and give the diagnosis and tell your doctor what the problem is. Um, and then I do also what's called interventional, which is we do procedures. So, for example, this week, um, we had a patient that we were looking for an aneurysm. So what I do is I have the patient on the table. I put a needle in the groin, and then through the needle access, I put a catheter in the groin, and in that artery, I float my catheter all the way up through your groin, through your belly, through your chest, past your heart, excuse me, up through your neck, up into your brain, and then I use the catheter to inject a medication in your brain. And I have a huge machine that rotates around you, and I essentially create pictures of your vessels in your brain, and I can look for things. It's pretty incredible.
It sounds incredible. It also sounds, I'm going, ooh, when you go through the groin. And I used to, one of my former careers, I worked in a cardiac catheterization lab.
Exactly.
And I know they would go from the groin to the heart and then measure, what was going on in the heart. So I can,
So
yeah.
essentially, it is the same thing they did in cardiac cath when you were working there. The only difference is when they went around the arch into the heart, I would make a right turn and go up into your neck. But it's the exact same approach. So we can go through your groin. We can also go through your arm.
Oh, really? Okay. So tell me, give me your journey. How did you, why did you become interested in medicine? And just give me the journey from the start to where you are now.
So I am a child of immigrants. My parents and family are from Trinidad and Tobago, an island right off the coast of northern Venezuela. It is a English speaking island. They speak a dialect of English. Um, Fun fact, historical fact, although it's not really that fun, but it's true, which is Trinidad and Tobago, of all the Caribbean islands, changed hands the most. In other words, between England, Portugal, Spain, everybody had a piece of that island for a short period of time. And for that reason, there is a large mixture of people there, Afro descendant, Spanish, Indian, you name it. We have those mixes of people in Trinidad and Tobago. I think simultaneously, that immigrant background in New York led to a serious focus to academics. Um, my parents were educators, and they basically had a no nonsense approach to school. School was the only thing they were interested in hearing about. And, growing up in New York, I'm a New Yorker, right? So, what were we doing as kids? We would play basketball. We would play soccer, play baseball like every other kid, but we did a lot of hip hop. You'd be out there battling and rapping outside of school or in the classroom, and it was very hard for me to come home and tell my parents, oh, let me tell you about this rhyme I wrote. My mother would be absolutely unimpressed. Right? There was nothing impressive to her about any rhyme or coming home and saying, "Oh, I made the varsity or the junior varsity football team." That was kind of like, "Oh, that's nice. That's nice." But how did you do on the last math test, right? So I kind of grew up in a house where education was always center, and I think that definitely played a role in my focus because in order to survive and not, get my teeth knocked out, you had to perform. And so that was the beginning of the academic drive. The beginning of the drive to medicine came because I have two uncles who were from Trinidad, but one went to Howard and the other went to school in England. And they were kind of the pillars of the family. They were physicians. And your audience may or may not know, it's very common in immigrant families outside of the US. Being a physician is a big deal. It's a big deal. Excuse me. If you're a physician in the West Indies, people give you a lot of respect. And so my uncles were very much so respected in our family. And I think that I always looked at them as paragons of the life that I thought that I wanted to live. So I embarked on this on this journey towards medical education. So in school, I was always a good student. Um, I thought actually school was relatively easy. And I say relatively because, there were classes that were very tough and gave me a lot of trouble. But um, I think from elementary to junior high to high school, if I studied, I was likely going to get a good grade. So what I learned is if you put in the time, you would get a good grade. Um, Now that would change later on as you got into college, but I can say that in my pre-collegiate days, I definitely had an association between effort and outcome. Effort and outcome. Excuse me. So towards my end of high school, I made the decision to pursue college. I wanted to go to an Ivy League school. My cousin was a freshman at Cornell University. And because she was a freshman at Cornell, I kind of, uh, my attention was drawn towards her and that school. So when I went up to Cornell for what we called Minority Hosting Weekend, which was a weekend they had, I don't know if they still have it, but at that time you would bring all students came from all over, predominantly the tri-state area, New York, New Jersey, Connecticut, and those students would come to Cornell for a weekend to be introduced to what campus life was like and to get a feel as to what Cornell was like. And that particular weekend I went, they had a concert there, and the concert had a Tribe Called Quest and Busta Rhymes. And so when I went up there and saw a Tribe Called Quest and Busta Rhymes performing that weekend, I was like, there's no other school to go to. If this is what college is going to be like, I'm going to Cornell and I'm going right now. So Cornell was my number one pick. So Cornell was a very difficult school. And that was when I realized that this association between effort and outcome wasn't holding true anymore. And why? Because you were now in an environment where everybody was coming from good high schools and came out with excellent grades and excellent stick to itiveness, if you will. With some smart kids up there. So now you being regular smart didn't cut it anymore. That's when I really started to learn about competition and curves and learning about nuanced skills and nuanced strategies to be educationally successful. Unfortunately, I learned it the hard way by falling in the bottom of the class in certain classes. Some of the science classes in particular were extremely difficult and very tough because there were so many kids. I can remember being in biochemistry, biology, chemistry classes where I was sitting in the balcony and there must have been easily 500, 600 people in the class. So, excuse me, you can imagine that being in a class with 500 or 600 students, you're kind of lost in a sea of bodies. And the professor is like down all the way at the bottom of the lecture room, and you can barely make out his face because you're so far back. This really put the onus on you as the student to figure out what you're going to be doing and how you were going to perform.
So let me ask you a question. All right here.
Sure.
What made you want to go into medicine?
So I think it was the combination of my own interest in science, and I did very well in science in high school. Science was a very strong subject for me, but also my uncles, them being the family pillars, and they got a lot of attention in my family, and so naturally I kind of always saw them as, all right, well, that's something that I want to do because they do it, which is something that happens a lot to human beings, which is you tend to gravitate towards things that you know. So if your family is in education, it's a good chance you may go towards something educational. If your family is in business or entrepreneurship, it's a good chance you're going to go towards that. Why? Because you go towards what you know.
Okay. And why did you choose neuroradiology?
So after Cornell, I went to Georgetown Medical School. I went to internship at Georgetown. I did 1 year of radiology at Howard. I did 3 years of radiology at Stony Brook Winthrop University in Long Island. And then it was time to choose a fellowship. And honestly, they said neuro was the hardest specialty to get into. And I don't think I particularly had an affinity towards it. I just heard somebody say the hardest fellowship to get into is neuro. And I said, all right, well, that's what it's going to be. Because I think in me, I've got this competitive streak and what we call in medicine kind of like a gunner. Um, I'm not a super gunner, but I am very competitive. And I think that's what made me say, I'm going to go towards neuro. So, excuse me, not only did I go towards neuro, but I really positioned myself to get into the top neuro program. And at the time, the top neuro programs were Harvard and Stanford. And I got into Stanford, and I chose Stanford to do my 2 years of neuroradiology training.
Okay. Wow. You know what? I'm just going to say this. You just look so young. Look like you maybe should like 21, 22. And I'm listening to you.
Look at all this.
I see that. But I'm like, I'm just listening to you and I'm like, oh my goodness gracious, he's only 20, maybe 25, and how did he do all this? But I I think it's just wonderful. So this is relationship matters. So how did your different relationships assist you in where you are today? I know you talked about your family, your uncles, but were there any other relationships outside of your family?
Sure. So one thing I learned from my father was a relationship king. My father was a champion networker, even though he probably never looked at it as networking. He was just a very social man. And I get my networking skill from him. And I learned very early, even though I early didn't know what I was doing, but I talked to a lot of different people. I was never shy. So even as a kid, if I talked to you and I remembered the conversation I had with you. And if later on, even if it was something like, oh, I need a red crayon, I remember who last month said they had a box of red crayons, right? So, excuse me. Even as a kid, I followed my father's footsteps in assessing where value is in people. And I think that I'll give you another example. Outside of my family, I can remember uh, a woman who used to, in high school, she took her own car. It was a van.
Mm-hmm.
And that's how I'm dating myself because people don't even have vans anymore. It was a big van, and she would go around every Saturday and Sunday morning, starting at like 4 o'clock in the morning, and pick up all these kids to take them to an indoor tennis center to teach tennis. So
Mm,
because we're in New York, right? So we don't have a lot of outdoor tennis. It's winter most of the time. So indoor tennis is pretty big and it's very expensive. So you can imagine between 6 a.m. and 8 a.m., that's probably the only time that she could get because it's probably the cheapest time because nobody really wants to play tennis between 6 and 8 a.m. for the most part. And I remember her because I looked at the way she was giving of herself.
mm.
I don't think anybody paid her. I mean, most of the kids we were kids. We didn't have any money to give her. Um, she filled up her own tank. She drove around because she had a mission to expose excuse me, expose young kids, and most of us were black or Latino, to a game that she thought taught discipline and it gave people the opportunity to get scholarships to go to college. I was kind of the outlier, honestly, because I was kind of like I played because I just liked it and I liked to hang around the other kids, but I really wasn't depending on tennis to get me into school.
Okay.
I actually kept that quiet because a lot of the other kids were, looking, needed that opportunity to get to pay for school. But I bring you back to the reason I bring her up, because this is a relationship that I made with her where my time watching her played a role in the physician that I am today, which is to understand that you work for the prize, you work for the mission, and you don't need people to tell you you're good. You don't need people to tell you, I like you. And I think a combination between her and my mother also reinforcing, my mother was always somebody that said, you go out, you do your job. You don't wait for somebody to tell you everything's going to be all right, or that you're cute, or that you're tall, or that you're fast, or that you're whatever it is. And I think what I did was I watched people, and I watched that woman for years. And that relationship that I had with her, even though it was from afar, even it was sitting in a chair behind her as she drove, sleepy herself at 5:30 in the morning, was a relationship that I used to really hone my own presentation and my own personality.
Okay.
So I was very relational with people. And that would be one big example of how relationships are not just only what I can get from you, what you can get from me, what I say to you, what you say to me. Relationships are always also they are apprenticeships.
Mm-hmm.
And apprenticeships not for a job, but apprenticeship for who do you want to be?
Wow. Does she know um, what an important role that she played in your life? Does she know?
Unfortunately, I don't think she knows. I kind of lost track with her over the years.
Okay.
I think that's a good question, and maybe after this talk, maybe I need to do my due diligence and see if I can't find her. Hopefully, she's still around and kicking because she was a strong lady.
Okay, all right. So, Dr. Dixon, I'm going to just take a quick, 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 brief break here. And when we come back, you said, I read something where you talked about the United States medical system. And that's all I'm going to say because when we come back, I want you to say exactly what I read. And then I want you to tell the audience why you think that.
Okay.
So don't go away. We'll be right back. We are back with Dr. Asante Dickson. Now, Dr. Dixon,
Yeah.
go ahead. Tell us about the medical system, the United States medical system, and what you think about it.
Okay. Well, that's a huge lift, but I will say that I believe that the United States medical system is the best medical system in the world.
Okay.
The factors I use to make that statement would be technologically, we are likely overall, and I say overall meaning availability of technology is pretty widespread. I know there are deficits and I know there are inequities, but technology has always been a strength of the U.S. medical system. Um, Access, I would say I'd give a 6 out of 10 for access, but I think the capitalistic drive behind the US medical system also produces a significant amount of physicians per year. And because there is money in education, unfortunately, medical schools have really blossomed over the past decades. And as a result, the competition, which is also is always good, has led to very well trained physicians. Um, It is not uncommon for physicians in other countries to want to come to the US to train, whether it's medical school or postgraduate, because the US system is viewed as the creme de la creme of medical education. And I say viewed because we all know that, perception and view isn't necessarily reality, but that's the perception.
Okay.
Um, like anything else, there are demerits and there are holes in the US medical system. One of the greatest disappointments in the medical system is that it mirrors and has mirrored the societal norms of the United States, which is to deliver care inequitably based on socioeconomic status, based on gender, and based on race. And I think if people hear that and they say, excuse me, if they say, "Oh man, this guy with the race business." Listen, all I got to tell you is that whether you love it or hate it, if the system is based on race, which our system was always based on race from the inception of this country, if the system was based on economic disenfranchisement of people regardless of race, then you can't be shocked if your medical system and your banking system and all your systems are demonstrating inequity based on race and based on economic inequality regardless of race. We can't be shocked.
Mhm.
So, as a person of color, particularly after George Floyd, we have a lot more visibility of the inequity in healthcare outcomes and treatment of people of color versus majority people. Um, where does this bother me? It bothers me not only in the realization that there is inequity, but it also bothers me as a physician because my training is not to give care based on race.
Right.
My training is not to give care based on gender. Excuse me. My training is not to give care based on whether somebody comes from a poor neighborhood or a rich neighborhood. So when we hear about these inequities, it really bothers me because I say, well, how are doctors able to engage in inequitable care even though there's no real overt training to do so? And the answer is, yeah, the training isn't necessarily overt, but people are people,
Mhm.
right? If you're a person that happens to be a doctor and you're a person that does not like women or you don't respect women, then just because you're a doctor doesn't mean all of a sudden you're going to give equitable care to men and women. If you have an issue with women, then because you're a doctor, you're likely going to give care that is unequal and that disadvantages women, right? And schools really haven't dealt with um, that bias that exists within doctors because they are merely vehicles through which care is delivered, and their personalities, their upbringing and their biases play a huge role into the type of care that they provide. So, speaking of relationships, one of the things that, excuse me, I always talk about is regardless of race, when you go to the hospital, you need to have a relationship and advocate.
Mhm.
The hospital is working in your best interest, but the hospital is a system and you can be easily lost in that system. It is easier to have a friend or a colleague or somebody, a neighbor who can sit with you, ask questions, review medications with you, talk to the doctors and the nurses, because just as your relationship with them is important for your own safety, physicians and medical providers also respect people who have relationships. If
Mhm.
you're by yourself and there is nobody else with you, there may be, whether it be subconscious or not, I'm not arguing, but you may be left out to dry more because they know there's no backup,
Mhm.
right? And so relationships go both ways. And I think people need to understand that the system of medicine is a system that is under tremendous pressure to produce profit. And so what you have is you have physicians such as myself, and of all races. This is not just black or white. There are many, countless physicians out there who want to give everybody the best care they can, but they're trapped against this dichotomous existence of I want to give my patient the most time, listen to them, talk to them. But in order to make money to keep the lights on, they got to push the patients through and get on to the next patient. That leaves us with a lot of stress because you know you want to give more, but you can't because you've got volume and you've got to push your volume through. These types of um, monetary pressures, unfortunately, impact people of color more. And that is because if I shorten my stays, if I shorten my consultations, if I shorten my listening, if I shorten my speaking, the patient who has greater adversity in their social determinants of health, how long it took them to get there, by what route did they get there, do they have money to cover their medications, do they have insurance, is there a family member with them? Those individuals, unfortunately, will have probably worse outcomes because their care has been shortened, because they've got such a weak background before they even step into medical care. So if you shorten your time with each physician, with each patient, and you're pushing patients through in order to keep productivity high, the patients with more money, they will survive that shortening, that truncation. The poorer patients, the more disenfranchised patients, they will suffer adversely.
Wow. Yes. Yes. And I was thinking, I've had so many careers in my life. And I worked, I'm not going to say the name of the hospital, but I worked at this particular hospital and I was a unit manager.
Hmm.
But they had a wing on the floor of this hospital where the more affluent or the
Hmm.
rich patients were. And on that wing, the floor was carpeted
Hmm.
and the care was, I mean, they didn't have to push, the little thing, the little button by the bed to call the nurse or the doctor. They were right there, right there, right there, right there, right there. So yes, I do see exactly what you're talking about. And when you said access, I thought about that too. And you mentioned also about insurance. And that's the first thing when you go in for care is, do you have insurance?
That's right.
And so my husband had very, very good insurance when he was working, and he was a cancer patient. And once they found out about this particular insurance that he had, OMG, it was like the
Off to the
floodgates.
races.
Oh my God. I mean, he got everything, including a nurse that would come by the house and give him this shot that he needed. And this shot was what, 3,400 a pop. And I'm like, you mean you're gonna come by the house? Oh
Yep.
yeah. I mean, it was so different from someone who I know that did not have really good insurance, so to speak. And she told me she felt just like she was on an assembly line, you
Well, it's
know.
very interesting because something I don't get. Americans are very savvy when it comes to smelling out the business aspect of, an experience. If we go into a restaurant, we'll say, "Oh, this is nice. Oh, this is nice." And they'll be like, "Yeah, well, they're just selling that because they just want to make more money." Okay. You go to a football game or a basketball game, and you're like, "Oh, this is great. My team, rah, rah, rah." But if you pay $30 for parking, they'll be like, "Oh man, they're just trying to get our money." And the owners of this team, this guy's a billionaire. What does he need with blah 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 blah. But somehow, when it comes to medical care, Americans have blinders on, and they kind of forget that medicine is a business. In order to keep the lights on and give you the service that you need in our capitalist system, you have to collect revenue. You either collect revenue from the patient, or you collect revenue from the insurance system, or you collect revenue from the state, or all three. And without that revenue, the hospital can't thrive. But somehow I think it may have been through the glorification of medicine in early TV shows, in my opinion. It kind of made Americans think that, doctors are different. They're doing this for the love of the game. And if you want to pay them in sheep, and if you want to pay them in cloth, they'll accept that. Well, that may have been the case back in the day, but most doctors in the United States are not accepting sheep and pigs anymore for payment. Although I'm sure there are some that will take, non-cash items because they may be working in areas where people are extremely poor, remote, and by no means am I saying that doesn't
Yeah,
exist, because I'm sure it does.
yeah, 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 yeah. And when you talked about relationships, I always think that if you can, you need to form a relationship with your doctor. And when I say a relationship, I mean not just based on your medical needs,
Right.
but with my doctor. I know about her kids. I know when she was had to put in a new driveway around her house. And when I go in, I ask her, like, how are your sons? Well, I know one of them wanted to go to college and the other one wanted to be a musician. What's
Right.
going on with that? And so it makes me feel that she's not just looking at me as, you know what I'm saying, like she's got to look on the computer to see who I am, you know what I'm saying? And I know that she can't talk with me for an hour.
Right.
You know what I'm saying? Because I know she's got another patient. But so but I know that I'm fortunate and blessed in this because I have good insurance. You know what I'm saying? But then with someone who doesn't have insurance and doesn't have a doctor, so to speak, and they have to go through the emergency room for care,
Yeah.
I know that they're treated differently. When the last time my husband had to go to the ER, um, and we flashed the insurance card, there were people who were still sitting there, you know, and they looked at us because they called his name,
Right.
and it's like, wait a minute, I've been sitting here for however long. So it is a difference, as far as access. And personally, I think, I can't remember the country, but I guess they would call it socialism, where no matter who you are, you get the best of medical care.
Well, what is also interesting is that I'm willing to bet that if we walked around to all 350 million people in the United States and said, "Do you want a socialist system where everybody pays into the system and excuse me, everybody can get care?" I would tell you the vast majority of Americans would probably say no,
So why do you say that?
because American culture is very individual.
Okay.
Um, American culture is not a group we type culture. Um, it becomes we when we need to fight somebody, like conflict. We become we. But when it comes to I will pay for you, so I'm going to work 5 days a week, 12 hours a day. You're going to work 1 day a week, but my money covers you. That is difficult for the American psyche,
Okay.
right? Even if people are mortgaging their homes to pay for their bills, it is difficult. It also kind of runs into the American kind of like pull yourself up by your bootstraps kind of mentality, which is work harder. Maybe you'll get insurance if you work harder, or but I'm not giving $2 to you for you to sit back and not work as hard because I'm giving you $2 to supplement your medical care. This is just my feeling.
Okay. Okay.
It's
Right.
just my feeling. I think that that capitalistic nature of medicine, even though it eats us up, is still a part of who we are. And it's kind of like we'll go down swinging to protect it because we want to be able to say that I'm not putting my money towards somebody else who's going to mooch off of me.
Okay. All right. We had a question that came in. It says, if it is in your power, what would you tell the new physicians how to interact with their patients?
Well, it is within my power for two
Okay.
reasons. One, I work with medical students and residents all the time. And two, I do have a company that what we do is we actually focus on the training of new physicians. And I can tell you what I focus on is humanism. The days of choosing who's going to be a physician, a good physician, based on who got a 98 versus a 92, those days are slowly changing because we're realizing that the person who got a 98, they may be smart, but they may have no bedside manner. They may have no interpersonal skills. They may have no emotional intelligence. And those are the type of doctors that I think the American public wants more interaction, as you stated. They want to be able to talk to somebody who can actually say, "Oh, my kids are this," and "Oh, how are you doing?" or "Oh, did you hear what's going on in the news last night?" As opposed to the old school doctors that tend to be trained kind of like, "I don't talk to you, you don't talk to me. I tell you what to do, you do what I say." Right? And if you question me, I will be insulted. Now, there are different levels of questioning. Don't get me wrong. Sometimes I get patients that I believe are a little over the top with the questioning. Like, if they ask me, do they want to see my medical degree, and
Yeah.
they get into questions like that. Sometimes I'm just kind of like, come on. I mean, we're in the middle of a hospital here. I don't have a medical degree on me, right?
Okay.
But I think that the new doctors need to learn humility, and that's who I'm interested in. I'm not interested in the person who only can get 100% but can't make eye contact with you. I don't want that doctor anymore.
Okay. So now is that a school? Let me see. I know. So what's the name of your school or your organization?
We are called Ascension Medical Educators,
Okay.
and we are a customized academic educational business firm where we support undergraduate students who are looking to get into medical school,
Oh,
and we support medical students and residents and practicing physicians. We serve everybody, but we have a specialty with underrepresented students. We are two Black men who are the owners and founders of this company. And if there's one thing we know, that is, how does the underrepresented mind work in higher education? So we focus on that. It's a specialty, but we have students of all backgrounds, from no money to you know, parents buying jets.
ooh, okay. Oh, wow. Okay. Okay. And so how long have you all had this company?
Started it in 2018. It was slow to start because, I'm full-time physician. My partner's full-time dean at a major medical school. And then COVID was slow for obvious reasons.
Mhm.
And I would say probably in the past year, we have really exploded. We are now working with 8 or 9 institutional clients or schools, about to be adding another one on soon. We also run the United Negro College Fund's Aspiring Physicians Program, which is a 3-year program where students apply to become a part of this aspiring physicians um, virtual program, where we are teaching them and supporting them in college in preparation for medical school. This year, we've got 10 applicants for every one spot. So it is serious competition for this program, and we run that for the United Negro College Fund.
That, oh my God, that is wonderful. That is so wonderful. I just put my hand on my heart. That's just amazing. Much needed work you're doing. So now, if people want to get in contact with you, um, you're on Instagram, so you can go to Instagram and look for Asante Dickson,
Yep.
MD, or excuse me, you can also find him on LinkedIn, Asante Dickson Easy.
Yeah.
Now, now that's very easy, people.
Yes. That's very easy.
Is his name. So we've got maybe a couple of minutes. So is there just something you would like to leave my audience with around relationships,
Yeah.
whatever?
I want to leave the audience with the idea that, relationships are a part of your development. Who you talk to, who you don't talk to, who you choose to ignore, who you choose to listen to, who you choose to associate with, hang out with, talk to on the phone or text. All of those things play a huge role in what direction you are likely to go, whether it be professional relationships or personal relationships. You are the master of your ship. If you are attracting people that don't have a good heart or don't have a good soul, if you attract or you're attracted to people that you've seen abusing other people, and I don't necessarily mean physically, but yet you still associate with those people, just like the American medical system, you can't start with slavery and then be shocked that there's disparate treatment among races in the medical system, right? You can't be shocked that now you found yourself in a quandary dealing with certain individuals in your career, in your job, in your marriage. If you started off chasing individuals that you've seen abuse other people, right? So honestly, I say you can't blame anybody but yourself. And we've all been there. This is not something unique to you. I have made that error and had to sit there eventually when the bottom dropped out and been like, I ain't got nobody to blame but me.
Yeah.
Right? I'd like to blame somebody, but the truth is I can't. I'm here because I followed something that I needed in that person that I didn't really assess properly as to how I needed to achieve it. And now I'm in trouble. So I say, when you associate with people, when you choose who you want to um, emulate, you use what you know of yourself. What type of personality do you have? What type of strength do you have? What type of weakness do you have? And you use those and you put it together to see whether this individual or these individuals will overlap and support that. If those individuals don't support you in your direction and in your mission, it's likely a relationship that, yeah, you can keep, dab it a little bit here, blah, dab it a little bit there, but you may not want to put too much behind it because it's not really aligned. And, I'm being generic because I think each individual listening can take that and put it to their respective situation because I think it works.
Mhm.
Whether you're talking about your man, your woman, your wife, your child, your boss, your employees, your the man at the bus stop, right? There are certain people that you need to go towards, and there's certain people that you just need to be cordial, hi, and then turn around and walk away, right? Because it's not for you.
I love those words. I really do. And I just want to put a comment that came on from Gwendolyn Dunbar. She said this was very informative and she's very proud to hear that you're giving back to the community and also recognizing the fact of racism. Dr. Dickson, thank you so much. You have given us so much value, and I really appreciate you coming on and being my guest. Finally,
Yeah, I know. I'm sorry about that.
finally. No, 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 no. But I really want to thank you for coming on. This has been extremely informative, extremely interesting. And I just want to say again, I love the work that you're doing. I hope I never have to really see you professionally,
Yeah, nah, you won't
but
do.
I wouldn't mind seeing you socially. So you have a beautiful, blessed rest of your day.
And you as well. And thank you so much. I've enjoyed this time, and I think the work you're doing is very important, which is spreading the word and opening people's minds to make decisions as to where they want to go.
Thank you so much, Dr. Dixon. See you next time.
Ciao, ciao.